I'm Julianne Temple. I'm a pediatric nurse practitioner at Community Care Center Pediatrics, which is one of the Southeast Georgia Physician Associates groups. I received my first COVID-19 vaccine in December of 2020, right before Christmas time, and the second one in January 2021. It meant a lot to be able to receive a COVID-19 vaccine. It was very uncertain times, especially as we were going through the fall of 2020. So it meant a lot to kind of start the Christmas break with the first step of being vaccinated, to protect my family and make sure that I wasn't bringing anything home to them, and to protect myself at work. I want to keep taking care of the kids that I take care of and the families. So being able to make sure I'm not getting anyone sick or myself meant a whole lot. In May of 2021, the ACIP kind of sent forth their recommendation that all adolescents and teenagers 12 years and older should receive their COVID vaccine, and the Pfizer vaccine was approved. My daughter was 12 at the time and received her first COVID-19 vaccine when she was 12 years old, and then the second one before her 13th birthday. So yes, my teenager is vaccinated, and my two younger children that are not in the age group yet, they're under 12, they're anxiously awaiting ACIP and CDC approval for their vaccines because they want to be kids and they want to get back to life, and we want to know that they won't get sick and end up in the hospital or worse. I deal with vaccines every day. That's what we do in primary care pediatrics. A lot of times it's educating patients and families on routine childhood immunizations. So I'm very familiar with how vaccines are developed, why we give them, and COVID-19 is another one of those viruses that we can protect against with a vaccine. So I felt confident in the research that had been put into the vaccine, and wanted my daughter to have that protection. I want kids to stay healthy. I want to keep them out of the hospital. I often tell families that's the job that I do. I used to work in the ER, and I do everything that I can to keep kids happy, healthy, safe, and out of the hospital. So we know vaccination is something that can do that, and I highly encourage it. Our hospital systems are strained nationwide, especially locally. Beds are full, ER is backed up. For all of our healthcare professionals that have been working tirelessly for over 18 months, this is something that we can do as a community to help keep ourselves safe, but help keep our neighbors, our children, those that are unable to be vaccinated or have immunocompromising conditions, to help to keep them healthy. This is a very safe vaccine. It's been given to over 150 million people in the United States. So I highly encourage it and hope that everybody makes the choice to keep their family and themselves safe and get vaccinated.